Hey everyone, and welcome to the MMOA Podcast brought to you by the Institute of Clinical Excellence. My name is Ellen Seppi. I'm a doctor of physical therapy practicing out of Littleton, Colorado. And today we're going to be talking a lot about the LIFTMOR trial and 5 tips for implementing it in the clinic. So if you're unfamiliar with the LIFTMOR trial. The LIFTMOR trial was a study that really was kind of a benchmark for our profession as rehab professionals that showed that high intensity resistance training can improve osteoporosis and turn it around and decrease that bone mineral density lost at the spine and at the hip. So if you're unfamiliar with this study, it's something that we talk about in our level 1, level 2, and live courses here at the older adult division. And it was really important because it addresses the fear directly that lifting heavy is somehow dangerous for bones. And it really showcased how important it is for us as rehab providers to be skilled and eloquent in talking about this with patients that, hey, doing strength training can turn around your bone density loss. And it's something that you should be doing if you have osteoporosis. And I can safely teach you how to do that. So again, if you're unfamiliar with this study, I'll go over some top points before we talk about those 5 clinical pearls for replicating it in your clinic. It was an 8-month-long study where participants worked out with an exercise physiologist who is also a personal trainer twice a week for 30-minute supervised exercise sessions. They did 4 exercises, including a deadlift, a squat, an overhead press, and a pull-up with a drop landing for bone impact. And the control group was also exercising. They felt like they were getting a pump. So I want to emphasize that the control group was not sitting there doing nothing. They were doing exercises like bicep curls and lunges. They felt like they were doing something hard. Here's the real clinical takeaway for how we can initially talk about this with our patients. Patients were lifting, the participants in this study were lifting at 85% of their 1 repetition max. And if that kind of sounds foreign and you're unfamiliar with what that verbiage means, it means that the weight was so heavy they could not do 7 reps. It was so hard that they could not keep going. So they did 5 sets of 5 reps at 85%. That is hard. And recently, Ice Physio had a gut check Thursday workout on the LIFTMOR trial exercises based on those for us to try as clinicians so that we can feel competent in having our patients do that. And I did the workout, and I'll tell you what, it was really, really freaking hard. 85% of 3-4 big lifts, that's really challenging. And again, the intensity was like 4, 5. That's how hard this is for people who are appropriately dosing it. So that's the rep scheme and the intensity, which are the most important factors of this study that we should take home as clinicians. The important thing is that all of these participants were safe. There were no adverse reactions to bones, and it did not cause vertebral fracture. The real take-home message after understanding this study is that postmenopausal women and then later men, because this study was repeated in men, should be lifting weights. It is safe and it is effective for turning around bone mineral density. Now, the 5 clinical pearls as a clinician replicating the study, because I talk about these exercises every day with my patients. Every single time that I talk with somebody who has menopause or I think might have menopause eventually, which is everyone, I use that chance to talk about these exercises. But here are 5 clinical pearls when you bring this study up to your patients. Number 1, you're going to be talking with your patients and they're going to be stoked about starting to do these exercises. They're going to feel awesome. They're going to lift a kettlebell that's 40 pounds and feel incredible. And they're going to feel unstoppable. Number 1 is initially tell people, do not buy equipment. Don't buy equipment yet. You don't know what equipment you're going to need, especially when you're looking at the back squat and the deadlift. it's really hard to estimate how hard somebody can push themselves on day one of teaching them these exercises. So in the LIFTMOR trial, there were 2 months of teaching the participants how to lift heavy and gradually increasing that dose before they got to their hopeful dose of that 85% of the 1 rep max. It took time. It's going to take you time. The difference is that the participants in this study were in a gym setting and they had access to weights. If your patient takes home this message and gets stoked and says, wow, I'm good at this, I can really push it, I'm going to buy a 40-pound kettlebell now. They might be capable of lifting 85 pounds and they will just have wasted money on that purchase because that's not what they're going to need at discharge. So number one, tell people, I'm so stoked that you're excited. Anticipate doing these exercises with me in the clinic. Do not buy equipment. Number one. Number two, the LIFTMOR trial excluded participants that had pain, specifically spine pain. Your patients might come to the clinic and have pain and osteoporosis. If you haven't taken our live course, we really want to emphasize you can treat both problems with weight training. But in the LIFTMOR trial, there was no compensation around pain because it wasn't there. You as a skilled clinician might have to use your judgment to say, okay, I might have to take it a little bit slower. I might have to be respectful of this person's pain. I might have to change how they do this exercise because I don't want them to abandon this exercise program because it did not work for their symptoms. So remember, as a clinician who's using this reference to this excellent and well done study, this benchmark study for our profession, that you might not be able to apply it to all of the patients on your caseload exactly as prescribed. You may have to work around pain, and that is okay. Number three, accept you may not reach that intensity, and that is okay. So the intensity in the LIFTMOR trial was 85% of 1 rep max, 5 sets, 5 reps. So that takes a lot of intensity and attention to intensity from a clinical standpoint. If you have a patient who is limited by insurance, who is limited by participation, or who is fearful, you might not reach that appropriate intensity, and that is okay. You are still changing somebody's life if you're not achieving that 5x5 of 85% of a 1 rep max. You're still showing them how strong and capable they are. You are still increasing their muscle mass. You're still improving their grip strength and potentially their balance with strength training, even if it isn't up to that dose. For a while, I pushed so hard to get that to that intensity, and I would settle for nothing when I was really blinded to the fact that my patients were still telling me about all of the improvement that they got from this exercise program, even at 3 sets of 8. That's okay. Number 4, kind of piggybacking off of number 3, you may have to have an exercise clinician, an exercise expert, group exercise instructor, a personal trainer in your arsenal to continue your job. If you have a patient who's coming to you for falls, for decreased bone mineral density, for pain, and their insurance or their participation is exhausted with you, you may have to pass the baton to another provider. And that's okay. It doesn't have to all fall on your shoulders. And if you can inspire exercise participation and get somebody stoked to start doing these exercises at home or in a gym, if you can pass that baton to somebody else, your job has been done. You have helped change their lives for the better. Number 5. So the LIFTMOR trial was limited to 4 different exercises, 5x5. You, friend, are not. So there are other things that we can provide as clinicians, like stomping and jumping, with relatively low volume needed to improve somebody's bone health. The LIFTMOR trial was limited. They could only do those 4 exercises because that was all in their study. We know as clinicians that there's a lot more that we can do for our patients. With that knowledge, you can supplement this program with other exercises. If you know that the only time that these exercises are going to happen is in your clinic, that's fine. Let's come up with other exercises that you can do, like stomping, like heel drops, like jumping, that we know will improve your bone mineral density in addition to your participation of these exercises. So Just to recap, number one, when you're teaching your patient these exercises, don't inspire them to buy equipment before they know the weights that are appropriate for them. Number two, recognize you're going to have to work around pain, unlike the study the LIFTMOR trial did. Number three, accept that you might not reach that intensity, and it is okay. You are still changing lives for the better with your exercise participation. Number four, you might have to refer to a gym friend to continue the work that you've done. And number five, it is totally fine to supplement with other exercises. If you're unsure of what those exercises are, we go into that extensively in our level 2 course, where we have an entire week dedicated to helping treat and understand osteoporosis. And then we actually practice all of these exercises in our live class, both the LIFTMOR trial exercise of deadlift, squatting, pulling and pressing, as well as stomping, heel drops, and appropriately dosing those for our patients. Thank you so much for joining me on this discussion about how to have clinical pearls from the LIFTMOR trial to your patient population. And I am so excited to know that our profession now embodies this responsibility to not just treat musculoskeletal injuries, but also treat people's bones. Thank you.